Good evening, everyone. So today is the last bone of your upper limb, which is, just a second, there is some dirt in this bone. Okay, so ready for this beautiful hand. This is the articulated hand. Now let's see, we all know these are the carpal bones. Carpal bones, they are short long bones. ঠিক আছে, this is a type of long bone. Refer to general anatomy again. Then the carpal, metacarpal, tarsal and phalanges. ঠিক আছে, এবার what we have to understand in this, when you get an articulated hand, what they are going to ask is the shape of this carpal bone. First of all, it's very difficult to utter the names of the carpal bone, so try to follow my pronunciation in the way I see it. The mnemonic for it would be, she looks too pretty, try to catch her. So my professor said that we are actually objectifying a female. Again, he has retired, and this particular sentence has stayed with me for a very long time. So she looks too pretty, that is distally we will have here, you can see, just look at your bone, you would be, I'm telling it in the ordered only, that is she stands for scaphoid, ঠিক আছে, scaphoid. Looks is lunate, the name itself, it justifies the shape, which is moon shaped. Lunar, anything, any lunar word refers to moon. Scaphoid, boat shaped. Scaphoid, lunate, triquetral, quadrilateral. We will have a tubercle in triquetral bone, and we have the P-shaped pisiform. Okay, when you go for your radiology classes, you would be seeing the pisiform identification. ঠিক আছে, তাহলে আমি distally বললাম. Now, then we have, she looks too pretty, try to catch her. That is your trapezium, trapezoid, capitate and hamate. Hamate, the word again justifies itself. There would be wedge-shaped projections. It is a hammer-shaped hamate. ঠিক আছে, capitate একটুখানি oval, and it is the largest carpal in your body, capitate. তারপরে trapezium and trapezoid. What you need to understand in this particular bone, hammer, you can see this elevation like a hammer. তো যেটা বুঝতে হবে সেটা হচ্ছে, the names of these bones are difficult to utter. Remember it through the mnemonic. She looks too pretty, try to catch her. You have to be very fluent when you say it in the Viva table. That is scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate and hamate. তো এইভাবে you have to say it. ঠিক আছে, এবার যেটা question হবে, that is the scaphoid fracture and ossification. তারপরে আমরা একটুখানি carpal, the peculiarity, the metacarpal, the peculiarity. Again, I said that any bone, when you are telling, you have to say the type, and if there is any peculiarity বলতে হবে. What I will do for this bone is I will say you the anatomical position and the side determination at the end, কারণ কি খুব একটা tough নয়. ঠিক আছে, তো now the next part would be the ossification, scaphoid fracture. Scaphoid fracture is generally asked again in your Viva table. Not much of a physical, this paper question. The question paper will not have this kind of thing, but I think once or twice it came. So I will discuss that, and then I will discuss the peculiarities of the first metacarpal, and then I will discuss then the phalanges. ঠিক আছে, তাহলে let's see the ossification. তারপরে আমরা এই scaphoid fractureটা একটু দেখব. ঠিক আছে, now let's understand the ossification. very easy to understand. এটা জিজ্ঞেস করা হয় খুব, সেটা হচ্ছে, locate this round bone capitate and go in this sequence, leaving the pisiform. ঠিক আছে, এবার কি করব, capitate, hamate, triquetral, scaphoid, trapezium, trapezoid, last pisiform. তাহলে capitate second month, ঠিক আছে, তারপরে you have the triquetral third month, বাকি যা যা বললাম 4th year and your pisiform 12th year in case of male and 9th and 10th year in case of female এই হচ্ছে ossification এবার আবারও outstretched hand-এ পড়লাম you're falling in the outstretched hand scaphoid neck fracture হয় এবং তার ফলে কি হয় the blood scaphoid is a part of the anatomical snuff box এরকম করলে একটা depression দেখা যায় হাতে anatomical snuff box skinny people will be able to see them very nicely so just have a look again please read your gross otherwise you won't be able to understand what is anatomical snuff box base and floor anatomical snuff box is a kind of depression as I was discussing that fossa and fascia these are very very common terms so snuff box is a kind of fossa I won't say fossa because fossa is related more to bones it's a depression you will understand what is an anatomical snuff box short note question so there you have the scaphoid as a base or the floor of the snuff box তো তখন কি হবে যখন এই ফ্র্যাকচারটা হবে নেকটা ফ্র্যাকচার হলেই বেসিক্যালি দ্য ব্লাড ভেসেলস 10 to 15% দু সাইড দিয়ে ঢোকে এই স্নাফ বক্সের এরকম করে কিন্তু মোস্টলি ইট ইজ ইন দ্য ডিস্টাল রিজন সো ওয়েন দের ইজ আ ফ্র্যাকচার দিস ব্লাড ভেসেল গেটস কম্প্রেসড অ্যান্ড অ্যাজ এ রেজাল্ট দের ইজ necrosis মানে the bone is devoid of the blood supply and there is death of the tissue তো এটা হচ্ছে necrosis refer and try to understand the meaning of necrosis এবারে যেটা আমরা বলবো metacarpal দেখানোর বিশেষ কিছু নেই just this is the metacarpal and these are the phalanges and we know that the thumb consists of 2 phalanges that is the reason it becomes like this and these have 3 phalanges তাই এই করা যায় ঠিক আছে so now let's try to understand the peculiarity of the first metacarpal তারপরে আমরা বাকি phalanges এর ব্যাপারে একটু ডিটেইলসে বলবো and lastly there would be the anatomical position and side determination long bone head আছে shaft আছে base আছে first metacarpal medially rotated by 90 degree base will form the shuttle joint concave or convex you know there is a radial and ulnar sides it's a sesamoid bone it doesn't articulate with any other metacarpal bone that is মানে side by side কোনো metacarpal এর সাথে articulate করে না এবং it articulates with the trapezium these are the peculiarities of the first metacarpal that is basically what is asked what is the type of bone and the peculiarity of the first metacarpal I think 5 points would do these are the important 5 points তারপরে আসে ossification fractures of metacarpals not much asked but I will still say it for the sake of completion তারপরে phalanges বলছি